Hi everyone, my name is Sara Paisner, and today I want to talk to you about PCOS, Polycystic Ovary Syndrome. PCOS is an endocrine disorder that involves excess androgen hormones and is often characterized by the formation of fluid-filled cysts in one or more of the ovaries. What does that mean? So, an endocrine disorder is a hormone-based disorder. And androgen is generally the male hormone, testosterone, that affects many women. PCOS is the most common endocrine or hormone disorder in females, and it affects 5 to 10 million women in the US alone. That's 1 in 10 women. Unfortunately, it's estimated that over 50% of women with PCOS go undiagnosed, which actually means it could be 1 in 5 women who have PCOS. So what are the symptoms? The symptoms for PCOS are excess hair growth, also referred to as hirsutism, on the face and the body, either irregular or heavy periods, or no periods at all. Infertility, acne, oily skin or darkened skin patches or skin tags, weight gain. Although PCOS can also happen to thin women, and not all women who are overweight have PCOS, but weight gain is one of the symptoms. Depression and poor sleep. Often women with PCOS have symptoms of depression, either due to how they view themselves because of the hair growth or other reasons. Sometimes folks with PCOS can have male pattern baldness, also headaches and pain caused by the ovarian cysts. There can be insulin resistance, as well as sleep disturbances. At this time, the cause of PCOS is not known. There is a lot of research happening on it, but currently there is no known specific cause. Generally, women are diagnosed with PCOS if they meet 2 of the 3 diagnosis criteria. So the 3 diagnosis criteria are irregular, heavy, or absent menstrual periods, hyperandrogenism, which is to say chronic high testosterone hormone levels, or polycystic ovaries. Your ovaries have multiple fluid-filled sacs. If you meet any 2 of these 3 criteria, you're considered to have PCOS. Again, currently there is no known cure. However, there are ways to manage the symptoms of PCOS. In terms of the risks associated with PCOS, insulin resistance is one of them. And this, of course, can lead to diabetes or pre-diabetes symptoms. There are potential for metabolic irregularities, which increase risk for heart disease or high blood pressure. Depression and mood swings can be a risk. And then the thickening of the endometrial lining can result in endometrial cancer. Now, what can you do if you believe you have PCOS? Talk to your doctor. Please go have a conversation with either your general practitioner or a specialist. An endocrine specialist can be particularly helpful. The symptoms of PCOS, each one by themselves, is hard to think of as a syndrome. But if you have multiple symptoms and you feel like something's not quite right, please go talk to your doctor. PCOS, polycystic ovary syndrome, is real and can have serious consequences if it's not addressed. Know that there are a number of national organizations that are working to increase knowledge and understanding of PCOS. The National Polycystic Ovary Association runs the PCOS Challenge. You may have heard of it. And they're a leading nonprofit support and advocacy organization globally for PCOS. Another great organization is the PCOS Awareness Association. They're also a nonprofit dedicated to advocacy of PCOS, and both of these are global organizations. There's also organizations that are more medical focused. So the Endocrine Society focuses on the goal to advocate for hormone research and endocrinology community. And then there's also the American College of Obstetricians and Gynecologists, which is acog.org, and that's a professional membership organization for obstetricians and gynecologists, and their goal is to maintain the highest standards of care for women's health care. If you're an electrologist and you see clients with these symptoms, consider encouraging them to go talk to their doctor. As we have seen in the electrology community, often hirsutism, hair growth, is the first symptom that clients with PCOS see and want to have remedied. You as an electrologist may notice these symptoms before your client even knows what PCOS is. Get educated, learn about PCOS as an electrologist, and be there for your clients. Let them know if you see symptoms that might fit in this diagnosis, that fit in this list of symptoms of the potential for PCOS. We are not doctors. Electrologists are not doctors, so we don't diagnose, but we can offer advice and encourage clients to go see their own doctor. Thanks for listening. If you have further questions, please give us a call. You can reach Synoptic Products at 919-908-0278, or you can drop us an email at info@synopticproducts.com. Thanks for listening.